Hello and welcome to Dialogue. What would usually be 40 days of enormous Spring Festival travel rush will be different this time. This year, local authorities are encouraging Chinese residents to stay put and celebrate the Lunar New Year where they are. So, how to keep safe for the New Year celebrations and how will vaccination help people in the pandemic? To talk about those issues, I'm joined by Dr. Gao Fu, Director General of the China CDC, Professor Liu Baocheng from the University of International Business and Economics, and Dr. Jerome H. Kim, Director General of the International Vaccine Institute. That is our topic. I'm Zhou Yue. Let me start with you, Dr. Gao. The Chinese New Year is around the corner, but the news of new COVID cases in northern province of Hebei and northeastern provinces have been making people very anxious. I know that you just came back from Shijiazhuang, the capital of Hebei. What was it like there?
Well, everybody knows we had a very small outbreak in Shijiazhuang. At the moment, we already have around a little bit over 1,000 cases, including the asymptomatic infections and the clinical infections. In general, in my opinion, let me use the word, that's kind of a normal, quote, normal. Why it's kind of a normal? Because we still have a pandemic in the whole world. The pandemic is still there. So this is a kind of, when you have a very small kind of outbreak, it's still under our prediction. So in general, anything in Hebei at the moment is under control. Because for the last year, the whole year, China, after the Wuhan outbreak, we learned a lot. There is a lot of experience and also a lot of lessons we learned. Here we know the lockdown of the city, of course, in small regions, not the whole city. And more importantly, lockdown the household, get everybody stay at home. More importantly, isolate all the potential close contacts. So this is a three major key issues we address in Shijiazhuang. At the moment, in my opinion, the turning point is there. We'll get the Shijiazhuang outbreak now.
But as you said, we have 1 year of experience of containing COVID since Wuhan. But why did the Shijiazhuang infection came to more than 1,000, and why did it take a month for us to detect that?
As you know, we had the first outbreak in Wuhan, that in the big city. This time, though, it's found in Shijiazhuang, but most of the cases, there are either connections between the city and the rural area. So this is it's a rural area outbreak. First, I should say the three bigs: wearing the mask, keeping the distance, watching your distance, and washing your hand. Those three W's strategies are not really implemented in those rural areas. So that's the first thing. And the second, because of that, and the second issue is not as early as possible reported for this outbreak. Again, we know the origin of this outbreak because in China, all the outbreaks is cleared after case by case. This one is, again, is an imported case, one imported case outside of China, and as a source of infection, and then spread around that area. The area is in the rural area. The whole basic capacity is not as good as in the big cities. This is why at this time,
but we still don't know
1,000 cases.
Why the patient zero got infected from imported virus. Do we?
I think we quite confident. Let me say, put it this way, 90%, because I myself was there. So this patient is a returnee from one of the European countries and who carried the virus, because the most important thing, we can do the molecular origin of the virus. Through the molecular, that means we can sequencing all the viruses, all the cases, the samples. So in this case, we sequence the samples from the suspected or suspicious patient zero. So the virus matched very well with the index patient or, the patient one in Shijiazhuang. So we are quite confident. So the virus came from the imported case.
So learning
from one of the
from the Shijiazhuang case, is the CDC network better prepared for a cluster infection, for example, in less developed rural areas?
That's a very big challenge to the whole China during this Spring Festival, the Lunar New Year in China, because we will get more people for get together, and a lot of people working in the city, they return home, the rural area, to celebrate their Lunar Year. So that's a big challenge for China. Of course, we learn. This is why myself, the DG of China CDC, I went there in Shijiazhuang. So I myself want to have a real feeling and real, practice what was going on there. So to me, I think we learned the lessons from this Shijiazhuang outbreak. Of course, the most important thing for the 4 earlies: early finding, early reporting, and early isolating, and early treatment. Those 4 earlies are the key to get the COVID-19 under control.
And some local authorities already suggesting people stay where they are, even if we are in a run-up to the Chinese Lunar New Year. And of course, Chinese people value this holiday very much. So you think it is necessary and it is legitimate for people to stay where they are rather than returning home?
I think that Dr. Zhou Yue, we discussed this earlier. It's always the risk and the benefit, the balance between the risk and the benefit. So of course, if we don't have any COVID-19 cases, of course you like to go back. So now I don't think we have a real policy to ask everybody to stay where they are. But the word we use, encourage. We are encouraging everybody to stay where they are. But of course, if you really like, you have something special cases, and if you want to go, you can go. But remember, protect yourself. So we encourage all the personnel stay where you are. So that's very important. It's to prevent us from this possible outbreak during the Spring Festival. So we are expecting to have this disease under complete control after the mass, mass vaccination. I think we are approaching there. By then, vaccination is the key to get this disease under complete control. But we are encouraging people stay where they are.
Of course, this will come with cost, Mr. Liu. Economically, restricting people travel will have a toll on the local economy, on the travel industry. What kind of a burden will that be on the national economy?
Well, I think the cost is really structural because definitely the hospitality industry, the transport industry will get hardly hurt. But in the meantime, there are savings because you do not really spend on tickets, and also you do not really spend on lavish dinners or firecrackers, etc. And so this could be a sentiment, cemented the savings on the other hand. And in the meantime, workers are being encouraged by the employers and by local government to work hard and getting higher compensation during the Spring Festival, which is really a contribution to productivity. So therefore, there can be a structural shift. But yes, how the transport industry being compensated, as a matter of fact, that we have a lot of redundant capacity already because we have to cater to the abrasion of the Spring Festival transportation. So this time, particularly the railway line can be more relaxed in that way. So, this is really a complex calculation. We do not really calculate on the loss on one particular sector of the industry.
It's a more complicated calculus than we usually used to.
Right.
And Dr. Gao, I know that the WHO expert team is now in Wuhan joining hands with Chinese scientists to trace the source of COVID. Has your institution, Chinese CDC, be part of this job? What have you compared notes with the WHO officials?
Yes, I have a few colleagues working together with WHO experts there, including the epidemiology and virology experts there. I think we are very actively involved from China's CDC side. Of course, origin of the virus is a basic scientific question. Yet, for 1 year, we still don't have any clue where the virus from. Of course, people have all this suspicion. They might come from bats. There might be an intermediate host, but for 1 year, we don't have any evidence to show there's a origin of the reservoir host or there is an intermediate host. Let's work together, get this scientific question done, not only from China, but all the scientists working together.
How
from all over the world.
How confident are you about tracing the origin of this COVID? Because 1 year has passed. Many of the samples probably have been compromised, and the early cases data, people worry whether it's kept well. How confident are you?
Well, I think we are relying on all the common sense, all the knowledge. So based on the common sense or knowledge about avian influenza virus, about Ebola, and even about the HIV, about the suspected cases for the SARS, MERS, we thought there might be a reservoir host or intermediate host. But these are the common sense and knowledge. Maybe the COVID-19 virus, might be somewhere, there must be origin, but it might take a few years to get this done. You ask me how confident I am. To be honest, I think we will get there, but I'm not quite sure when and where.
About vaccination, the mass vaccination campaign has been going on in China and the rest of the world. Are you satisfied with the progress of the vaccination? I was told that about 20 million Chinese have been vaccinated. Can we go faster? Should we?
I think I'm very happy. I'm very happy with the progress. Of course, you can always try to say, well, things could be a little bit better. Could a little bit it's quicker. Again, risk and benefit balance. Remember that. So I think we are everything is about adequate. I don't think appropriate. I don't think we can move. Of course, you can always say, okay, let's push a little bit harder. But by the end, to tackle this problem, to be the winner, or to combat the COVID-19, we need mass vaccination.
So what is keeping the mass populace from being vaccinated now? Because production capacity or because of our cautiousness?
I think both. You can always have this so-called vaccine cautiousness or vaccination cautious always there. I think generally speaking, in China, it's the public realize that vaccination is the only way to get this disease done. So I'm not worried about the cautiousness. Of course, the production and the process is another issue. We are building up, for the whole production capacity in China. I think we have so many lines of the vaccine under development. Now we have the line for the inactivated vaccine already there. We have some recombinant protein vaccine, adenoviral vaccine. They are in the line. I think we will get there.
And do we also have plans to approve foreign-made vaccines, for example, AstraZeneca and Pfizer and Moderna vaccines here in China?
Yes, international collaboration is the key. It's very important. And more importantly, the different countries and different companies, they are using different approaches. We don't know which approach will be the best. By the end, I think the human being will realize which one is the best. We might have the convergence.
Okay.
People will try to use one or two kind, but at the moment, we have to try every possibility.
One last question for you. Is it still the plan to vaccinate about more than 80% of the Chinese population?
I think at the moment, 70 to 80% is our target.
All right. I know that you're busy. I have to let you go. Thank you very much, Dr. Gao. About the vaccination programs, Mr. Liu, people worry about, is it really necessary? And can we keep up with the production? And is it too much a burden on the finance? Because that means we have to populate 1.4 billion Chinese, while there is very few cases of infection. What is your take?
Well, the viruses are there. They are hiding, and they could travel in the air. So we try to, put a turf on us, and this is not really the final solution. Simply to avoid the virus. So therefore, you have to wear the armor, and you have to activate your, domestic system to fight against such sort of virus. So therefore, vaccination is the solution. But right now, there are a lot of people, including myself, who are there to take a wait-and-see attitude and see why. One is that where is the side effect? Economic cost is not really a big deal because the government really finances it quite a lot. And the other is that we want to see that because there are so many vaccines now, within China we have 3 available, and now we have globally and some, as you mentioned, from Pfizer, from Merck, etc. So which one works the best for you and for your own self? Situation. So that's one. The other is really China, as Dr. Gao mentioned, China has a lot of complexities, between urban area, suburban area, and countryside. Distribution is also a big problem.
Yeah.
And also there are free riders, because when you say, okay, 80% have the vaccination, the whole country will be safe. Then, okay, I would expect,
everybody wants, or a lot of people want to
Right.
be that 20%.
That's right. So that's social psychology that's at work.
Dr. Kim, what about the situation in South Korea? I know there are also cluster infections. What is your response, and how do you look at China's case?
So the South Korean outbreaks are a little different, and they are traced to particular types of behaviors and violations in some of the rules that the government has established. As with many countries, Korea is encouraging the use of masks, requiring the use of masks, maintaining distance, avoiding crowds. Restaurants are still open, but they stopped serving people in the restaurant at 9 o'clock. A lot of other high transmission venues have been shut down. This is a little different from the response in China. So in Korea right now, there are no cities that are locked down, despite the outbreaks. And recently, over time, since Christmas, the 25th of December roughly, the number of infections per day has been going down. Now, that's been challenged recently by an outbreak in some unauthorized schools, and the government is responding with a hope that they will be able to loosen some of the restrictions prior to the Lunar New Year celebrations.
And I know that
as with many countries, I think Korea
the Spring
is awaiting.
Festival is also, Lunar New Year is also a big festival in South Korea. Is there any restrictive rules on travel during the Lunar New Year time?
So I think people are being encouraged to stay in place.
Okay.
The government is thinking about loosening up some of the restrictions that were put into place during the worst part of the outbreak in December. And that would include no gatherings of over 4 people. So, people have been working very hard. The government has been working hard to test, track, isolate, and treat. They've continued to encourage social distancing and the use of masks. And they've really been trying to get the number of infections per day down so that some of the restrictions could be loosened in anticipation of the Lunar New Year celebrations. But as with many countries, Korea is also still waiting for the introduction of vaccination.
Vaccinations, what is South Korea waiting for? Because you don't have homegrown vaccine options. You're waiting for the mass production capacity to go up. What is the plan in South Korea?
So Korea actually participates in an effort called COVAX, which is an organization, a facility that is led by the WHO, an organization called CEPI, and Gavi, the Vaccine Alliance. 189 countries participate in COVAX, and those countries will receive roughly 20% of their anticipated demand by the end of 2021. So that's about 2 billion doses being delivered all over the world. Korea will benefit from that as well by purchasing through the COVAX mechanism. Korea has also made special deals with various vaccine companies in order to supply 2 doses of vaccine for all Koreans.
You mentioned COVAX because we understand no one is safe until everybody is safe. So if the world does not see equitable distribution of vaccines, that means we cannot live in a COVID-free world. As a public health official, what is your estimate of vaccination program on a global scale? What might go wrong and what should we do about it?
That's a really great question. So COVAX is one of the first attempts to bring innovative vaccine technology to all countries in the world within the first year of introduction. That hasn't happened with many other vaccines, particularly vaccines that are being deployed for global health. So this is a really important effort, and it's a sign of its leadership that China has joined the COVAX facility, and now the new incoming American administration has signaled its support for entry into COVAX. This will mean, I hope, that more vaccine will become available, more funding will become available, and that will allow vaccine to flow to countries, not only high-income countries, which also participate in COVAX, but to low and middle-income countries. And as you said, no one's safe until everyone's safe. And also we know that if there is not some equity in the distribution of vaccines in the first year, then the cost to high-income economies like China, the United States, Europe, could be $5 trillion. And also, globally, suffering will increase. Global COVID deaths could double if there is not equity in the first year of distribution of those vaccines.
Yeah. So, Mr. Liu, probably the decision makers must realize this is not only makes economic sense, but makes public health sense. But the problem is, do they have joint actions? Helping others is also helping yourself. Do they realize how important this is?
Well, of course, I think this is really common sense that nobody's safe. If one is left out, unless one is completely isolated for life. So
the reason I ask this is because America and Europe is still very much occupied with their own domestic response.
That's right. But the question is that there is a priority in consideration because people always make decisions to benefit the locus of what they really care. So it is really the upper class, it is then the middle class, and then the lower class, and then outsiders. So people make a sequence, which is very natural. But of course, there has to be concerted efforts, and the international agencies will have to play a more powerful role in that to provide equity. So you can't expect everybody to be, to be heroes. So therefore, how we can really motivate companies and civil organizations to work in that regard for equity distribution, and which is, in the end also serves to the high-income countries, high-income population. So there is also the public education in that regard, and then multi-stakeholder involvement is the key for a more fair and equitable distribution.
And Dr. Kim, what do you expect Europeans and Americans do differently? They are trying to vaccinate 1.5 million in a month in 2021 in America, and probably Europe, especially plus United Kingdom is also a similar plan. Are they too selfish? Should they spare some more shots for other parts of the world?
That's a question that the individual countries will need to answer. We know that if we look at pre-orders, the United States, European countries, and other countries around the world, not only high-income countries, but upper middle-income countries, have pre-ordered vaccine. Canada has pre-ordered 4 to 5 times more vaccine than they need for their population in order to ensure that they will have vaccine as quickly as possible. I think that one of the most important things to recognize is that, for instance, in Korea, they expect to have 70 to 80% of the population vaccinated by the fall, by September or October. The United States is the same. So the goal here is to achieve high levels of vaccination in all the countries in September of this year. So in the United States, I believe that the estimate is between 1 and 1.5 million people should be vaccinated every day. Now, they've fallen behind those targets, and the new administration is pledging to increase access to vaccination, make it easier. But also at the same time, they're going to need to secure additional supply of vaccine because the last thing you want is to run out. And we're already running into
Is there a danger of running
supply
out?
constraints.
It seems
many people are aware.
different versions of vaccines coming up from Merck, from Johnson & Johnson, and some Chinese versions as well. Will they be able to fill the gap?
Yes, so those are great questions. Right now we have 6 vaccines that have been approved in different countries around the world. 7 if we include the Bharat vaccine that's been approved in India. It's going to be very challenging, particularly in the beginning, to get enough vaccine to all the countries that need it right away. The goal is that by the end of the year that we should have at least 2 billion doses through COVAX. The estimates are that by the end of 2022, there could be billions of doses available. Again, who's going to get it and how quickly will they get it? Those are the questions that we need to work out in a multilateral sense, working together to solve the problem of the supply of vaccine. Now, not all countries can use the Pfizer or the Moderna vaccine because of cold chain issues. Could other countries, once Sinopharm's vaccine is approved by the World Health Organization, could it enter the COVAX mechanism? Could countries around the world use it? Absolutely. Because we know what the efficacy of that vaccine is. It looks to be about 79%. It looks to be safe. And if that vaccine can be provided, as Sinopharm says, as 1 billion doses in 2021, that will make a great progress towards providing vaccine to countries all over the world and to people all over the world.
So that will probably take place by the end of the year. And before that, every country still has to be very vigilant and have very strict epidemic control in place. Is that right, Mr. Kim?
Absolutely. Vaccination isn't the only answer. Vaccination is a weapon. But at the same time, you need a strategy, and that strategy will continue to include masks, distancing, hygiene, and avoidance of crowds. And countries will still need to do testing, tracking, isolating, and treating.
Right.
All those things, all those elements of pandemic control will need to continue to be in place in addition to the vaccine until we achieve the necessary levels of vaccination to have herd protection.
And Mr. Liu, maybe the Chinese have comparatively contained the epidemic well or better, but complacency isn't some option that we can choose. It seems that even in the Chinese New Year, there still be concerns about the COVID.
Yeah, we have successfully, I think, avoided the attack, but we have not really eliminated the viruses. So that's why the vaccine is acutely needed. So therefore, we still need to take extra precaution. So for the Lunar New Year, and last year we were taken by quite a surprise, but now we are better prepared both ideologically and also physically and economically even. So then, let's look to public education to be aware of the vaccine. So therefore, we have to move forward.
Anyway, we have to be prepared. Thank you very much. And thank you, Dr. Kim. You've been watching Dialogue here on CGTN. I'm Joe in Beijing. Goodbye.